Welcome. My name is Dr. Chioma Kas-Osoka, and I am a postdoctoral research associate with Meharry Vanderbilt Alliance's Community Engagement Research Corps. And today I will be discussing my dissertation research. The title of this presentation is Interviewing Service Providers to Develop Sexual Health Education Policy Recommendations for Justice-Involved Youth. Justice-involved youth bear a disproportionate burden of sexually transmitted infections, such that rates are 8 to 10 times higher than youth without a history of detention. Youth in this population also indicate lower rates of condom use and have more partners. The purpose of this study is to draft policy recommendations in response to the barriers experienced by service providers in addressing the sexual health needs of justice-involved youth. The theoretical framework driving this study is the socioecological model of health behavior. First derived by Brofenbrenner and adapted by McLeroy, this theory posits that there are multiple influences of behavior, and each level of influence interacts with one another, from the individual to policy. And that environment is just as important in shaping behavior and changing behavior as the individual themselves. We conducted semi-structured interviews with 6 individuals who worked directly with justice-involved youth in the state of Georgia. A total of 6 policy recommendations resulted from these interviews. Each policy recommendation will be presented based on the level of implementation, from the individual to policy. At the individual level, service providers struggle to have conversations with youth about sexual health topics for fear of losing their jobs or just not knowing what to say. Elizabeth, a mental health clinician, states that every therapist is required to continue to explore and expand their knowledge base. And so I don't know how many people actually promote the development of their understanding of sexual needs, but if you're not interested in it, then you're not going to pursue that continuing education. One policy recommendation would be to encourage service providers to seek continuing education courses geared towards communicating with adolescents about sexual health topics. At the interpersonal level, service providers mention youth being involved in the juvenile justice system as a direct result of their lack of knowledge around consent. A policy recommendation would be specifically to teach youth about consent. Daniel, a caseworker, describes his interaction with an adolescent involved in the juvenile justice system and states, "The issue goes back to consent. Where it gets muddled is implied consent. She was dressing like she wanted it. She was drinking drinks like she wanted it, so I was going to give it to her." At the community level, service providers mention not knowing what organizational resources are available to youth, especially those that are in rural areas. One of the policy recommendations would be to create policies that promote collaborations between service providers and community organizations. Examples of these would be health fairs or online resource portals. Victoria, a care coordinator, stated that it takes time to learn about the resources that are available in your community or their community. Sometimes kids are in a community that's an hour away from me, so I don't know what's available there. At the organizational level, service providers mention youth being released from incarceration without knowing what resources were available in the community. A policy recommendation to address this issue would be to provide an exit program for youth post-release. A short 30-minute video, pamphlet, or guide indicating available resources. Alex, a sexual health educator, stated that educating them on linkages before they get out would be a really big one. It's difficult since the turnover rate is all over the place, but definitely letting them know what community resources are available. And finally, at the policy level, service providers mentioned sexual health not necessarily being an important topic unless it was directly related to the circumstances of the youth themselves, so pregnancy or sexually transmitted infections. 2 policy recommendations would be to, 1, mandate sexual health education for all youth involved in the juvenile justice system, and incorporate sexual health education into probation requirements. Rebecca, a therapist, emphasized that the minute a kid is detained, they should go through some type of sexual health orientation, some type of sexual health training. This study shows that addressing the sexual health needs of justice-involved youth requires a collective effort. Service providers, public health professionals, and policymakers must collaborate to create a system where sexual health is deemed a priority for justice-involved youth. Future research should involve determining the feasibility of incorporating the drafted policy recommendations into the juvenile justice system by interacting with juvenile justice personnel. Thank you.